Period blood is a powerful indicator of your overall health, and while it's a subject shrouded in myths and misconceptions, understanding what your period blood color means can be both enlightening and empowering. Each month, millions of women around the world experience menstruation, yet very few of us talk openly about the changes we see in the color and texture of our period blood. For some, the sight of dark brown blood is alarming. For others, bright red or even pinkish hues raise questions. What do these colors really mean? Are they normal? And what myths should you stop believing right now? Let's begin by understanding what period blood actually is. Menstrual blood isn't just blood. It's a combination of blood, uterine lining, mucus, and other vaginal secretions. As your body prepares for a potential pregnancy each month, your uterine lining thickens. If pregnancy doesn't occur, your body naturally sheds this lining, resulting in your period. The color and consistency of this shedding can vary from person to person, and even from one cycle to the next for the same individual. The most common period blood colors are bright red, dark red, brown, black, pink, orange, and occasionally even gray. Each color tells a slightly different story about what's happening inside your body. Let's break it down, color by color. Bright red period blood is often seen at the beginning of your period. This color typically indicates a steady flow and fresh blood that's moving quickly through your body. It's the color most people associate with normal periods, and it usually means that your uterine lining is being shed efficiently. For many, bright red blood lasts a day or two before darkening. As your period progresses, you might notice dark red or even brown blood. This change is perfectly normal. Darker blood has typically been in the uterus or vagina a little longer, giving it time to oxidize, which causes the color to darken. Brown or even almost black blood is most often seen at the beginning or end of your period, when the flow is lighter and the blood is moving more slowly through your body. This is not a sign of poor health. It just means your body is clearing out older uterine lining. Some people notice pink period blood, especially at the very start or end of their period. Pink blood is often the result of period blood mixing with cervical fluid, which can dilute the color. Light pink blood can also occur with very light flows, and is common among those who exercise a lot or have low estrogen levels. However, if you notice persistent pink spotting between periods, it may be worth consulting a healthcare professional, as it could be a sign of hormonal imbalance or other underlying health conditions. Orange period blood is less common, but it does occur. Like pink blood, orange blood usually results from mixing menstrual blood with cervical fluids. Sometimes, orange discharge can also be a sign of infection, especially if accompanied by a foul smell or discomfort. If you notice orange-colored blood and experience itching, burning, or an unusual odor, consider checking with your doctor. Black period blood can be unsettling, but in most cases, it's just very old blood that's taken its time to leave the uterus. As blood sits and oxidizes, it naturally turns darker, sometimes appearing almost black. This is most common at the very start or end of a period and is usually nothing to worry about. Gray or off-white discharge, on the other hand, is not a typical period blood color and can signal an infection, such as bacterial vaginosis. If you ever notice grayish blood or discharge, especially if it's accompanied by a strong odor, pain, or itching, it's important to seek medical advice right away. Now that we've explored the spectrum of period blood colors, let's address some of the most persistent myths that surround menstruation and what your period says about your health. One common myth is that normal period blood should always be bright red. In reality, menstrual blood can change color throughout your cycle, and a range of reds, browns, and even pinks are all perfectly normal. The color of your period blood is influenced by how quickly it's leaving your body, how much oxygen it's exposed to, and even your hydration levels. There is no single right color for everyone, and what's normal for you may not be the same as what's normal for someone else. Another myth is that dark or brown blood is a sign of illness or poor health. In truth, dark or brown blood is usually just older blood that's taken longer to exit your body. It's common at the beginning and end of a period when the flow is lighter. Unless it's accompanied by other symptoms like severe pain, foul odor, or unusual clots, dark blood is generally nothing to worry about. There's also the misconception that period blood should never have any clots. Small clots, especially during the heaviest days of your period, are normal. They're simply the result of blood pooling in the uterus and beginning to clot before leaving your body. Larger clots, bigger than a quarter, or clots accompanied by heavy bleeding, severe cramps, or fatigue may be signs of underlying conditions like fibroids or hormonal imbalances, and you should discuss them with your doctor. Some people worry that changes in period blood color mean they're pregnant or experiencing a miscarriage. While it's true that spotting or unusual bleeding can sometimes be an early sign of pregnancy or miscarriage, it's important to remember that there are many benign reasons for changes in period blood color. If you're concerned about unexpected bleeding or spotting, especially if it's accompanied by other symptoms, check with your healthcare provider for peace of mind. Now, let's talk about what your period blood can reveal about your health. While color alone isn't a definitive indicator of health, paying attention to changes can help you notice patterns and flag potential issues early. For example, consistently very light periods or pink-tinged blood might indicate low estrogen levels. This can be caused by excessive exercise, significant weight loss, or certain health conditions. Low estrogen can impact bone health and fertility, so it's something to monitor if it persists. On the other hand, very heavy periods with frequent large clots and deep red or purple blood can be a sign of hormonal imbalances, uterine fibroids, polyps, or other reproductive health issues. If your periods are so heavy that you're soaking through pads or tampons every hour, or if your periods last longer than 7 days, it's a good idea to talk to a healthcare provider. Bleeding between periods or after sex, regardless of the blood color, should also be discussed with a doctor. While it can sometimes be caused by hormonal fluctuations, it can also be a sign of infections, polyps, or other medical conditions that require attention. It's also important to remember that certain lifestyle factors and medications can alter your period blood color and flow. Hormonal birth control, for example, often results in lighter, pinker periods, or even missed periods altogether. Changes in diet, stress levels, or travel can also impact your menstrual cycle. Another area of concern is infection. If your period blood is accompanied by an unusual odor, or if you notice grayish or greenish discharge, it could be a sign of a vaginal infection. Other symptoms to watch for include itching, burning, or discomfort during urination or sex. Ultimately, the key takeaway is this: period blood comes in many colors, and most variations are completely normal. The best way to understand what's normal for you is to track your periods. Note the color, consistency, and any accompanying symptoms each month. This information is incredibly valuable, both for your own awareness and for your healthcare provider if you ever have concerns. Don't let myths or misinformation cause unnecessary worry. Periods are a natural part of life, and changes in color are usually just your body's way of clearing out the old to make way for the new. If you do notice sudden, drastic changes, like very heavy bleeding, persistent spotting, or unusual colors like gray or green, don't hesitate to reach out to a healthcare professional. Your body's signals are worth listening to. In summary, period blood color is a fascinating window into your reproductive health. From bright red to brown, pink, orange, or even black, each color has a story to tell. Most of the time, these changes are simply a reflection of your body's natural rhythms. By debunking long-held myths and tuning into your own cycle, you can feel more confident and informed about your health. Remember, knowledge is power, especially when it comes to understanding your body.